Sunil.
Thank you, Bharti. So basically today I'll be speaking to you about low temperature sterilization. There's a gas sterilization.
अभी एक टॉक है बस
10:25 तक.
नहीं
So basically the commercially available, either you can use the ethylene oxide sterilization, or as Bharti told, you can go for a plasma sterilization. Preview, I want a bigger screen. Monitor, please come over. Yeah, that's fine. Okay. So the ETO is a basically low temperature sterilization. The little bit tell me about the properties of ethylene oxide. It is heavier than air. At 500 parts per minute, it is a colorless, odorless gas. At more than 500, it is a sweet and ether-like smell gas. And the problem is it's vaporizes at 51 degree Fahrenheit, and it's mainly very useful for the thermosensitive products like plastics and all, or hollow tubings, hollow tubings, plastic materials. If you want to ETO sterilize, then the ETO is the best options. But the only problem with ETO sterilization is the gas residuals on the sterilized material. Whatever the materials, plastic material you use, they tend to have a residual ETO or ethylene oxide. The other problem is it's very slow acting, so the duration of cycle of the ethylene oxide sterilization is a very elaborative process. It acts by a principle called as alkylation. But the one thing is, by the presence of moisture is very, very essential for the ethylene oxide to act. So the bactericidal activity increases in the presence of a moisture. So you need to provide a moisture during the sterilization process. It is effective against most of the organisms, starting from gram-positive to fungi, even to the spores can be effectively tackled. So what are the other issues with the ethylene oxide? It's highly a toxic gas, sometimes can be an explosive. Why I told about the explosive, I saw a scenario in one of the OTs. Just to compromise with the electrical commercial, reduce the cost of it, somebody uses a cylinder for sterilizing, getting the heat for the steam sterilizer. If you keep that such sort of a sterilizer and the ETO in the same room, there is more risk of an explosion and other things and all. Preferable to keep both the parts. The ETO should have a separate chamber when compared to when you are clubbing up with the other autoclave processes. And it is a cancerous hazard that gas can be a cancerous hazard. It's a mutagenic and sometimes a neurotoxic also. So your all working staff is exposed to all these gas chemical hazards. So ethylene oxide, either it can be used as a pure 100% ethylene oxide, or it can be mixed with carbon dioxide as a mixture of gas at a proportion. So when you club with ethylene oxide or blended with a carbon dioxide, it works under the pressure, but when you use an 100% ethylene oxide which is available in cylinders, it places under the vacuum. Like any other the sterilization process, it is very effective in getting a sterility assurance level that is 10 to the power of -6. What are the variables you should look like? Unlike steam sterilization, you should look at the temperature at which the ideal temperature, what should be used, what is the humidity, what should be the ethylene oxide gas exposure time, what is the ideal concentration of ethylene oxide one should use, what is the distribution and the penetration. These are the parameters one should look in when you are using an ethylene oxide sterilization. Unlike steam sterilization, here also it goes through certain phases of sterilization process. The one is called conditioning or preconditioning, where you maintain optimal temperature and humidity. Next is the gas dwell, where that phase you introduce the ethylene oxide gas into the chamber through in cartridges. And the next is the most important phase, that is a degassing. Degassing means once the process is complete, you should allow sufficient time for the residual ethylene oxide to be cleared off out of the material you used as well as from the chamber. So that is a degassing or the aeration is the most critical step in ETO sterilization. Wrapping and other things, same as the any class B autoclave you use. One side is a semi-transparent, you can use the indicator, and other is a opaque paper material is there. So looking at the process of ETO sterilization, the first thing will be the preheating. During the preconditioning phase, you start to heat the chamber. Once you have done that, heat the chamber and at a particular temperature. Then you take out all the air which is present in the chamber. A vacuum is created by removing the air as much as possible. Make sure that complete air removal is done. Then you have to humidify the load. So once you humidify the load, the humidity is a very essential thing for the water is vaporized so that you get an ideal optimum humidity for the effective cycling process. So once you humidify the load, ethylene oxide is released by the pressing of the cylinder, so the cartridge gets opened. So depending upon the load, the various concentration of ethylene oxide can be used. So under negative pressure, once it's done, then the gas should be, process is complete, gas has to be removed completely with the vacuum. And the last phase is the degassing phase, as I told. What is an optimum temperature for an ethylene oxide sterilization? Preferably it will be between 48 to 57 degrees centigrade. For every 10 degree centigrade, lethality doubles. So that is a Q10 effect, what we call. Heat is transferred on the load during the preconditioning phase of the cycle. Next, humidity. Why humidity is very essential for ethylene oxide sterilization is, once transfer of heat is optimum in this, when the moisture is there, absorption and desorption of ethylene oxide occurs more effectively, and even the sterilization process is also very effective. High humidity decreases the antibacterial activities, lower causes the defective sterilization. So you should maintain an optimal humidity of around 30 to 80% in your sterilization process. Gas concentrations, variable sizes of cylinders or cartridges are available. So anywhere ranging from 40 to 300 grams. Depending upon the load, you can use the ideal gas concentration. Preferably it should be around 400 to 800 milligrams per liter. Gas exposure time, preferably it is 3 to 5 hours. It is not the gas exposure time which is takes the cycle length here. It is a degassing phase or the removal phase of the ethylene oxide which is the most important thing. The one thing I told, conditioning, preconditioning, we maintain all the parameters, that is the temperature, pressure and the humidity. First the air is removed, I told, then the leakage test is done, all this I showed in the video. Sometimes the initial evacuation of air can be done by using a nitrogen also. You do a multiple cycles of introducing a nitrogen into the chamber. It is called as the nitrogen dilution, which effectively removes the air, so that creates a much more vacuum. You can do a shallow as well as the deep cycles to get rid of the air. The sterilization process I told, ideally you should have an optimum gas concentration. Lower gas concentration in the chamber sometimes can make the cycle lengthier. In between the cycle, if you feel that there is no adequate concentration of ethylene oxide in the chamber, you can add the additional cylinders in between the cycle also to get an optimal load of the ethylene oxide. Degassing, it's the most important phase I told. So preferably done by circulating a filtered air onto the load at a temperature of 30 to 50 degree. So get rid of all your ethylene oxide from the residue after the sterilization process, and it is the longest part of the cycle and it is a very essential part of the cycle. So it can be done either within a particular thing, or there is a separate aeration cabinet you can have, but make sure that you should have a separate unit for the ethylene oxide in it should be done. But venting system is very, very essential. You should have a separate tubing. Make sure that the pipes which exhaust the ethylene oxide should be let out properly. That should not cause toxicity to the working staff which are there in the OT and all. So these are some of the essential things one should look for when you are doing a aeration phase. So sometimes you require a special infrastructure, but never club multiple steam sterilization in a single room. Having even the ETO in the same room also. You can have a very small compatible room for the ETO sterilization. So what are the advantages? As I told, it's a low temperature sterilization. Material compatibility is very well maintained. It's also an overkill process. You can be rest assured that sterilization process is complete. It has got a very good penetration, highly efficient. Large sterilizing volumes also can be done. There are different capacities of ETOs which are available, and revalidation process is also very simple. These are some of the advantages, but there are certain disadvantages also. One thing is, it is a lengthy cycle. Safety concerns and toxicity issues with the ethylene oxide. It's a flammable gas and not recommended for flexible tubes. You cannot do a phaco tubing ETO. So any lengthy hollow tubes, it's a difficult thing. Requires a special room conditions and a separate ventilation system, and high annual maintenance cost. Sometimes if you have an high volume surge, and probably, but you cannot compromise if you have got a vitreoretinal setup also, or any surgical thing which requires a use of plastic materials or more of a tubings, cutters and other things. Better to use an ETO. If you are an anti-segment surgeon, still you can compromise with your ETO, but I feel it is the instrument and you should not neglect with the ETO thing. As Bharati told, there are 3 or more models of ETOs which are available. One is a manual, the other is a semi-automated and an automated mode. Automated mode, you get an LCD display, printouts, everything. You can set the parameters accordingly based on the volume and the load. So the automated version is slightly expensive when compared to the manual mode of ETO. model of ETO. There is one more modification which has been done. The main concern with ethylene oxide sterilization is the amount of dosage of ethylene oxide we use. Anyway, can we reduce the amount of gas we use in the sterilization process? There was a modification which was done known as the microdose sterilization. Here what they do is, whole sterilization is confined rather than to a chamber, to a bag sort of thing which you can see here, so that the minimizing the usage of gas reduces the economic and environmental costs, and even the gas exposure is little bit reduced. But the only thing with the problem with this is the load will be limited to a smaller load size when compared to, you can't do a large volume sterilization. Validation, like any other steam sterilization, is very essential thing. It detects the failures and controls the cost, and you cannot be a peace of mind for the surgical procedures. Again, it can be validation can be done with the chemical indicators. That's at the equipment level. You have an AMC, you have a regular checkup of your machines, whether they are running properly, cycles are running properly or not. And of course, the chemical and the biological indicators, which already been dealt up. The biological indicators are much more reliable when compared to the chemical indicators, as I told. But the only difference is the organism which we use for the steam sterilization is different, and the organism which we use in the biological indicator for an ETO is different. Usually we use a gram-positive spore-forming organism that is called Bacillus atrophius. This is the organism which we tend to use commonly in the biological indicator for the ETOs. Chemical indicators, it is the same. All class 6 sort of chemical indicators are available, and it is both external and internal chemical indicators are available, which you can use any of the things we use for the steam sterilization. Lot of has been discussed about the process challenging devices, which is can be done for the ETO also. Revalidation definitely has to be done at a regular interval. Probably I suggest every 6 months or a year you should keep on revalidating your decide about the product design and the packing which is suitable for your setup. Process and equipment parameters has to be reassessed. Usually it consists of a 1 half cycle or a 1 full cycle you can do in the revalidation process. Another most important thing is the engineering controls. We tend to neglect the mechanical aspects of the instrument, so keep checking your equipments regularly. And the work practices, teach your working staff what are the hazards of ethylene oxide, how it should be disposed, and how they should be kept in the separate thing and other things and all. There are certain devices which are available which detects the leak of an ethylene oxide, like detectors are available. There are certain ethylene oxide residual testing meters are available, which you can put it onto your pocket and suggest how much is the exposure for your workers. There are many methods which you can detect and there are reading instruments which are available. All these reduces the chances of hazardous exposure to this. So in conclusion, it is a safe and effective method of sterilization, ideally useful for, I won't suggest hollow alone, but it's mainly for the thermosensitive products. And toxicity is a concern. Gas sterilization is a mandatory tool for a quality healthcare practice. You cannot say that, I got an autoclave, somehow I'll manage without having an ETO. But definitely ETO is a very essential tool for the day-to-day quality healthcare practice. Thank you.